Since the emergence of coronavirus disease 2019 COVID-19, formerly known as the 2019 novel coronavirus 2019 nCoV in Wuhan, China in December 2019, which is caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, more than 4.18 million cases have been reported in 187 countries, regions, resulting in more than 286,000 deaths worldwide. Despite the fact that most COVID-19 cases and motalities were reported in China, the WHO has declared this outbreak as the sixth public health emergency of international concern. The COVID-19 can present as an asymptomatic carrier state, acute respiratory disease, and pneumonia. Adults represent the population with the highest infection rate, however, neonates, children, and elderly patients can also be infected by SARS-CoV-2. In addition, nosocomial infection of hospitalized patients and healthcare workers, and viral transmission from asymptomatic carriers are possible. The most common finding on chest imaging among patients with pneumonia was ground glass opacity with bilateral involvement. Severe cases are more likely to be older patients with underlying comorbidities compared to mild cases. Indeed, age and disease severity may be correlated with the outcomes of COVID-19. Introduction. In December 2019, an outbreak of pneumonia due to unknown cause occurred in Wuhan, China and rapidly spread throughout the country within 1 month. The pathogen of this disease was confirmed as a novel coronavirus by molecular methods and was initially named as 2019 novel coronavirus 2019 nCoV. However, the World Health Organization (WHO) announced a new name on February 11, 2020 for the epidemic disease, coronavirus disease COVID-19. To date, COVID-19 has affected people in more than 187 countries, regions, including Taiwan, and has become a global threat. In addition, the Coronavirus Study Group of the International Committee on Taxonomy of Viruses has renamed the virus, which was provisionally named 2019 nCoV, as Severe Acute Respiratory Syndrome Coronavirus 2 (SARS-CoV-2), based on phylogeny, taxonomy, and established practice. 5 Prior to this, on January 30, 2020, the WHO declared the COVID-19 outbreak as the sixth public health emergency of international concern. Therefore, this outbreak constitutes a public health risk through the international spread of disease and requires a coordinated international response. Increased dissemination of information through use of the Internet is associated with increased transmission of information from all geographical regions and across disciplines regarding recognition of SARS-CoV-2 and COVID-196. Nevertheless, important factors associated with COVID-19, specifically age and sex distribution, incubation period, clinical features, and optimal treatment, remain uncertain. Therefore, herein, we performed a literature review, focusing on the epidemiological characteristics and clinical manifestations of COVID-19, including asymptomatic carrier state, acute respiratory disease (ARD), and pneumonia. Severity of COVID-19. COVID-19 was defined as the respiratory disease caused by SARS-CoV-2 that emerged in China in 2019. The clinical manifestations of COVID-19 are protean, which include asymptomatic carrier, and pneumonia of varying degrees of severity. First, asymptomatic cases were diagnosed based on positive viral nucleic acid test results, but without any COVID-19 symptoms, such as fever, gastrointestinal, or respiratory symptoms, and no significant abnormalities on chest radiograph. However, the transmission of COVID-19 through asymptomatic carriers via person-to-person contact was observed in many reports. Second, patients with ARD defined as laboratory-confirmed COVID-19 cases had respiratory symptoms, however, chest-computed tomography did not reveal signs of pneumonia. Third, patients with pneumonia defined as COVID-19 cases had both respiratory symptoms and pneumonia on chest radiograph. This category includes severe pneumonia, either respiratory rate, and a critical condition, characterized by respiratory failure requiring mechanical ventilation, shock, or other organ failure requiring ICU management. Epidemiology. As of May 12, 2020, data from the WHO revealed altogether 4.18 million cases of COVID-19 in 187 countries or regions have reported confirmed cases, including mainland China, Japan, Singapore, Hong Kong Special Administrative Region (SAR), Thailand, South Korea, Taiwan, Australia, Malaysia, Germany, Vietnam, the United States, Macau, the United Arab Emirates, Canada, France, the Philippines, the United Kingdom, Italy, India, Russia, Finland, Sweden, Sri Lanka, Cambodia, Nepal, Spain, Belgium, Iran, Egypt, Israel, and Lebanon. etc. To date, the reported number of deaths is 286,000 deaths. However, asymptomatic patients or patients with mild COVID-19 symptoms may not seek health care, nor receive diagnosis, which leads to underestimation of the burden of COVID-19. In summary, these studies disclosed several significant findings. First, although most patients with COVID-19 were middle-aged adults, elderly patients and children also contracted COVID-19. Second, there is a higher prevalence of men with COVID-19 than that of women, however, further studies are warranted to confirm this finding. Third, healthcare workers and hospitalized patients could be infected by SARS-CoV-2 in the hospital setting. Finally, at least 20% of COVID-19 cases had underlying diseases, and more severe cases were more likely to have comorbidities than non-severe cases. Incubation period. It is essential to know the incubation period, the time elapsing between the moment of exposure to an infectious agent and the appearance of signs and symptoms of the disease, for infection control and guidance for the duration of isolation. Initially, Li et al. Used the data on exposure among 10 confirmed cases in Wuhan to estimate the mean incubation period, which was 5.2 days, 95% confidence interval, c. 4.1 to 7.0. The 95th percentile of the distribution was 12.5 days, 95% c. 9.2 to 18.201. Estimation based on 125 patients with clearly defined exposure periods in China indicated that the median incubation period was 4.75, interquartile range 3.0 to 7.2 days. 0.15. Using the travel history and symptom onset of 88 confirmed cases that were detected outside of Wuhan in the early outbreak phase, Bakker et al. Estimated that the mean incubation period was 6.4 days, 95% credible interval 5.6 to 7.7, ranging from 2.1 to 11.1 days, 2.5 th to 97.5 th percentile. 0.21. However, Guan et al., using a large sample for estimation, suggested that the median incubation period was only 3.0 days, but could be as long as 24 days. 0.11. Overall, these estimates will be refined as more data become available. Detailed epidemiological information based on a larger sample of patients infected with COVID-19 is needed to determine the infectious period of SARS-CoV-2, as well as to determine whether transmission can occur from asymptomatic individuals during the incubation period. Don't forget to subscribe to my YouTube channel.